you're an MD as well as a journalist. You know, that used to be, people now say, well, if you're going to go to medical school and do all that work, why become a journalist? Have we lost MD journalists, and what happens if we really do lose them?
I think actually there are more and more of us who are going to medical school or getting some other kind of training. I don't actually think medical school is necessarily the best, for example, training. And I should say I went to medical school intending to be a doctor. That's what I was going to do because my mother loved me and I was the son and grandson of a doctor, so I should be a doctor. But I think that what it does for me and for other people who practice it, and there are a lot of people on TV who are MDs, of course, is it gives you a sense of the system. But if you leave it to do journalism, you actually can hopefully be skeptical about that system and do things that way.
So it's an interesting sort of balance. You would think a little bit of a black sheep there. Go to medical school and now, Mom, I'm a journalist?
Yeah, they got over it.
Okay. So you talked about an issue of consumer demand, saying, look, I know I'm sick, I know I've got a problem, and if you don't treat me, I'm going to go find somebody who will. And so the system is essentially feeding itself back in a feedback loop like Tom talked about earlier, and so it's spiraling upwards in this endless cycle. And yet, if we're going to ask people to break that feedback loop, I suspect we're going to have some problems. Do you think that there's anything that can break that feedback, that positive feedback loop that's going in the wrong direction?
Well, I think there are some good models. I think that if you look at, again, the relationship that some people have with their doctors, and if we can highlight some of the ones where people aren't rushing out to take medication. If you look at, some of the speakers this morning who talked about just common sense things that aren't about diagnosing, I think you can have a lot of success there. There's a great section in the Archives of Internal Medicine, this might be more directed at doctors, called Less is More. And if we start to all think, at least in the back of our minds, less is more, I hope that will percolate through the whole system.
I hope so too. Thank you very much for coming up.